Ah. All
Long
right,
day.
Kenshin, thanks for volunteering for today and just being part of this. I really just want to share with people, what's been you took this course. We did the Strength Summit. You've been behind the scenes as an intern. You've now completed PT school. Congratulations.
Thank you.
And somehow I snagged you and got a way for you to get into this course right after you literally graduated on like Tuesday or Wednesday or whatever that was.
Yeah.
And now you're taking the summit as a new grad, and your intent was to help out, but you took a lot of things away for today.
Yeah.
What'd you expect to get out of the course today? And then we'll ask afterwards, like, what was the key takeaways? So first, what did you think about that? Like, what did you think about when you were first coming in?
Yeah. So at first I was expecting to just be in the back, right? Just kind of like helping with the tech, right? Just kind of recording, making sure everything's pristine.
Yeah.
But as you're talking, and we're here all day, I'm like starting to kind of listen in naturally. And just kind of started taking away pieces of information about, periodization and like planning for athletes and strength and conditioning, which are kind of things that you don't see too much of,
Right.
Especially in PT school. So going fresh out of it, but using the language was like very eye-opening for me.
That's great.
Yeah.
What level of difficulty would you say the course was? Like beginner, intermediate, advanced? Like who would be good to take the course?
I actually think beginners all the way up to advanced, because I did both. I was in school when I first did something like this.
Yeah.
And it's super difficult when you don't get the language.
Yeah.
Because if you don't get the language, then it's like right over your head.
Yeah.
But like being done with PT school, understanding like what clients and like athletes need.
Yeah.
And just kind of like understanding that language first.
Yeah.
It kind of came a little bit more naturally because it kind of follows a lot of those like concepts because it's science based. It's not just like these theories. So in that sense, it made a lot of sense for me. So it wasn't anything that was like, oh, this is like too complex.
Right.
I can't understand this. It's definitely something I'll review when I'm home. Yeah.
Just like any other course. I think the reason why I created the course was because I think people, PTs or aspiring sports PTs or whoever you're talking about who want to work with athletes, I think the gold standard is, I want to take my CSCS. Like that is you've probably thought that, you've had, classmates. And for me, I thought, I think the CSCS is good. I think it's like good enough. And that's not to say anything bad about it. I just think that, if you're a rehab professional or you want to get in the strength world, I think the CSCS is like, it can be the abstract. The terminology can be like over the top. If you don't have anybody consolidating that information, it's tough. And context, like how do I include this with an ACL? How do I include this? What about my back pain, sciatica person? Like that definitely doesn't apply to them. And my whole goal and intent, the reason why I did this was because I saw a huge gap in where people struggle, and that's the interpretation of the information and really making it easy. That's why I built the course. So out of all the things that you took away from, like what were the like 2 to 3 highlights that you like loved about the course that were really helpful that you can, as a new grad, that you can use?
I think one that really stands out is it was just almost like a side conversation we had about like clients and like A, B, C, and D type of clients.
I'll share with that. Go for it.
I think that was like something super important that you need to understand as a new grad. It's not always going to be this like very, very clear cut, A patient, B patient. Sometimes you get the C's and D's, and that doesn't mean like the standard drops, but it's important to have the realization of like what to put your energy and time into.
And let me describe to anybody who's listening to this. I basically said there's a grid. The struggle I get with a lot of clinicians is that if I say, hey, they say, I only have a certain amount of time in the day. I'm documenting on all these people. how do I can't write strength programs or pay all attention to every single 40 people I see, whatever it is in a day. And there's a grid. And on the vertical axis is outcomes, and on the horizontal axis is your relationship. The outcome is based on your skill, like can you get patients to get the outcome that you want? And on the x-axis is the relationship that you build with them. And naturally you have patients and athletes that like, man, they just love you, they gravitate to you, you love them, right? Good relationships. The next question is, once you've established good relationships, can you get the outcomes that they want and need? I think that if you have a relationship with them, that already helps your outcomes. Yeah. Now the question is, do you have the skill? This is skill on outcomes, and this is your personality and relationship building on this side. Mm-hmm. And the way I broke this up was on the relationship side, if you have high relationships with them, really good, and get good outcomes, those are A patients. Like, gosh, those are phenomenal people you want to work with every day. Yeah. People who have good relationships with you, but you're not getting the outcome, you need to develop your skill. That's what comes, those are your B patients. Yeah. The people who get really good outcomes, but you have a really bad relationship with, it was very transactional. They only came in for like the short term, wham, bam, thank you, ma'am, you know, like they're only here for the short term pain relief, and they are not here to like make friends or anything. Those are your C patients, and the ones who have no relationships, non-compliant, no outcomes, those are your Ds, get rid of them. What you want to do is get your time to spend on the A customers or the A patients, because once you design programs and you put energy toward those people, then you can tell, is your skill good enough in programming? And they'll tell you good data, and you spend your time. If you're saying, Chris, who do I write programs for? Try your A patients, the ones who have good relationships, good outcomes, put all your effort there, and then figure out if it's working, fine tune, and then try and get your B patients up to A's, and then move your C's to B. Like, it's just this factory, and I think that's important. So I think that's what you're leading to, and I think people who are watching this, that I think you understand. You said something earlier. You're like, I'm just concerned about burnout.
Yeah.
Right. And burnout is a concept that has nothing to do with your workload. It has to do with your emotional workload. Mm-hmm. And yeah, you can see 30 people in a day, and that's a lot. But the emotional, like how much you give out of your soul, how much that you give, and like you're trying to help people. Mm-hmm. I think when you do that 30 times a day, that's exhausting. And I think there's an emotional burnout to that. So in order to control for that, you give your highest attention to your A patients, which is about 20% of whoever you see. Mm-hmm. So if you see 20 people, I think you said like, oh, in a caseload, you might see 16 or 15 people. Yeah. 20% of that could be in the ballpark of 3 to 4 people. That's not hard.
Exactly.
That's not hard. So that was one takeaway. Mm-hmm. What else?
I think another big one was structure. So structure for the patient, for me, so that my patient can, or my clients can get a better outcome. You know, as a new grad, you want to do everything. Right. But sometimes if you do everything, you can hurt them. And, you know, just finding the right time to do the right thing, I think is a big takeaway here, where you need the structure as a student, and I'm going to be a student the rest of my life.
Yeah, of course.
Having that structure to make a program for my A and B clients is going to be, that was like a very big takeaway for me.
Yeah, so if you figure out who your A, B's, and C's are, and you have structure, then your outcomes match that. Mm-hmm. You have less emotional burden or challenges, and now you like feel good about being at work. And I think that's separating it, and that's literally how I approach like patient care. Mm. And I think that once you figure that out, your emotional burden is going towards the people who like want it. Like they're your magnets. They're the people who are like, man, I just love being around Kenshin. I love being around Chris. Mm. And those people, they're like, whatever you give me, I'll try it. And that's when you know you're actually you're making an impact. Yeah. So those are your two big takeaways.
Yeah, and then the structure. You know, you have the structure. You make the relationship, they see the outcomes improving, and then they trust you more. Then the C's become B's, the B's become A's, and then it's just this. Yeah, exactly.
Yeah, so, and I appreciate that. Thank you, Kenshin. I really appreciate you. And I think for anyone out there who's thinking about like courses and things to do, I think that there is clinical skill development. I think that's very important, and that's what we worked on, a lot of clinical skill development in terms of programming, but my passion, my wheelhouse is finding patients who you will help throughout their lifespan with health, with fitness, with mechanics, with movement, And I think today we talked about like what our mission statement is as a profession. I think movement is important. I think when you look at like the sports section and all the domains, like 8 domains and pillars of like success to be a sports clinician, movement is like only in the rehab portion. It's like you still have acute injury management, you have strength conditioning. I think when you understand the spectrum of health, return to sport, injury prevention, your roles and your responsibilities. Sometimes you're a sports psych, sometimes you're a nutritionist, sometimes you're a strength coach, sometimes you're working as a primary, and I think that once you can grasp that concept, if you're looking for clinical skill development, I think that it's important you develop the little things, but I think to broaden your view is where our profession is going to be going. And I think if you don't get a hold of that fast, you'll be stuck in this wormhole of I need to get better at mobilizations, and then people don't get better.
Yeah.
And then you're stuck on more outcome-driven stuff. So I got to learn taping, and maybe that'll change it.
Yeah.
When in reality, you were selecting the wrong person to pay attention to. You weren't planning and structuring. You then don't have a chance to build relationships with people. So you're just in transactional mode. More mobs, more taping, more things, more negative outcomes, more emotional burden, more burnout, more patients, more evals, less outcomes.
Yep. And every session you're trying to prove to them, like you're like, come on, please, just get on my team, But that should be happening at the initial eval.
That's exactly
having
it.
the plan in the beginning so that they know what they're getting into each session rather than trying to get you to get on my side, right, with each session. So
I think and that was a big thing that we talked about. Your initial evaluation it's the make it or break it point. Yeah. And I remember this when you came in to help with I think you did you helped me during the flood. And I was like, hey, what's the scariest part? What's the hardest part? And you're like, initial evaluations. And you're like, I'm just stressed. Am I going to do the right, test? Am I going to do the right provocative, whatever it is? When you take this framework and you understand that that's like a small piece to what they want, they're not concerned about, is it the Terry's minor or Terry's major? Yeah. That's not what they're concerned about. They're concerned about, that's what they're telling you because they don't know how to tell any better, but they're like, I'm just scared. Like, so is it torn or not? No. What they want to know is, how long is this going to take? Yep. What is it going to take? And what do I need to do to get there? Yep. And when you were stressing out, you're like, I don't know which test to do. Fucking do one. Yeah. Just do one, do enough, and then just create a plan, set them up for success. And what Kenshin's saying is like, you really don't need to dig yourself out of a hole. I feel like PTs, they dig themselves out of a hole every session. They're like waiting for like, well, the hip's a little tight. Okay, let me fix that. Well, the back's a little tight. Let me go to that. And so you're very reactive. Yeah. And today we designed a plan or a program to get people to get to 6, 12, and 18 weeks out at the initial evaluation to get buy-in. Yeah. But ultimately to take the emotional burden off of yourself and say, this is not my problem. I have a solution for you, but this is a 6-week plan. You're going to do 4 to 6 weeks of neuromuscular control, 4 to 6 weeks of endurance, 4 to 6 weeks of strength. Yeah. I'll get you to that point and beyond. But if you don't do these at every step, there's no way you'll be successful. So now what happens? Yeah. I don't have to stress out anymore. And as a new grad, that is massive. Yep. If you can take that concept for the next 2 to 3 years, I mentor a lot of new grads, a lot of established clinicians. Most new grads are hitting burnout by 3 to 5 years. 3 to 5 years. You just spent like so much of your time, love, and energy, and it's not because you don't have the right skills. That's the crazy part. Yeah. It's because your approach and you're taking these people home with you. You're literally like, I saw 32 people and they just sucked the soul out of me. But I think you just take out, like, get rid of that, put yourself in a better scenario at the eval, set the tone, and it puts you in a position where you don't have to stress, the pressure's off of you, and then you don't have to worry about the provocative test that's gonna like make it or break it. You know what I mean? So.
I felt that if I'm more proactive with that initial eval and make that programming first, then if they come in with like tight hips or something or some other issue, then I could be reactive and
100%
fix that then and there. Yeah. But I don't want to start like that. I don't want to start being like, oh my God, this is tight. I got to work on that first.
Right.
Oh wait, but now
Right.
this is messed up. Like
Yeah.
it was just this snowball effect of
Correct.
like pressure, and then so that's what I realized today, that I need to be a little bit more proactive with my initial evals and really have structure within my process so
Yeah.
that the patients feel confident and therefore I'm confident.
I love that. Thank you for doing this. For those who are out there, Kenshin loves being on the camera, so it took a lot. It took a lot for me to get him on. I'm very appreciative of your time, Kenshin. I appreciate everything that you've been part of. And for those who are out there and you're always looking for mentorship, I think mentorship to me is it's not teaching you a mobilization. It's not teaching you a program or template, a strength conditioning program. I don't think it's a manual technique. I don't think it's a taping technique. I think mentorship is helping you problem solve. I think it's helping you give a framework and then letting you figure out what works and doesn't work. And I think mentorship is typically skill driven. Yeah. Teach me more skills. Teach me how to tape. Teach me the neck mobilization. Yeah. That's really going to change my clinical practice. And I think that's like the old guard. I think it's an old way of thinking. I think mentorship is helping you problem solve and like, where in this framework am I missing? Because I don't have good patients on my schedule. I feel like I'm just diving in, looking for better treatment. And if you're looking for clinical skill development, I think that you're at like phase 0.001 of your career path. I think the faster you can get onto problem solving and really helping people across health and less on movement impairments and always looking for the short-term fix. Yeah. I know it sounds super deep, but I think mentorship is getting you out of that, honestly. I really think that the next generation of PTs will be based on how do we improve people's health. I think that'll be the thing. So, I think,
I agree with everything you're saying. It's funny because right before this, I was like, I do not want to be on this camera right now. I was like, I hate this. But that's also mentorship. Like you're getting me out of my comfort zone and getting me on camera. But that's part of it. So 100%. I hate it, but I appreciate you for it.
Believe it or not, I used to not love to be on camera, and now I think the hard part. So, and I said this in the conference today, like I used to be illiterate, right? Like I didn't know how to read or write. I was 18 years old, didn't know how to read or write. I hated freaking reading. I was like 18 trying to learn how to read. You know how embarrassing that was? To be like 18 years old and trying to learn how to read. And I just attacked it, right? Absolutely attacked it. And with now what I see, like being able to help people, that's the addiction. But people can't feel that unless you're on camera, unless you're on audio. Like they can't feel it if they're not in front of you. And I think that's my bias towards the camera. And my passion is getting people over that line to keep challenging them. So you've been part of that process. So to get you on camera has been a big journey.
Oh yeah, it's been about 5 years.
I appreciate you, Kenshin, and for those out there, if the summit's for you, that's great. If any of my courses are for you, that's great. Ultimately, you need help being pushed. You need help problem solving. You don't need help on clinical skill development. Yes, that's helpful. That's sexy. But I think you find a mentor that helps you be a better version of yourself in any way. So it's like public speaking skills, challenging your thought process, getting you away from like the same thing that you're used to, pushing you to be a better version of yourself and not using like, well, I'm not good at that. I don't want to do that right now. I think it's a scapegoat. So Kenshin is a big testament to that. And I wanted to share that with the world and anybody who's been in my world. People like Kenshin, you're a go-getter. You know that you have a great potential. But the problem is that somebody's not helping you express that because you're self-imposing your limitations on like why you can't. You make excuses. I shouldn't do this or I shouldn't do that. That job won't get me. I don't know if I'll be able to write that program for you. And you just got to figure out how to get somebody in your world to literally like push you. And people have done that for me, and that's why I do it for others. So, Kenshin, I appreciate you, man. Thank you.
Thank you.